Good evening. This is Dom Coric from Carolina Neurosurgery and Spine Associates in Charlotte, North Carolina. I'm Executive Medical Director of Spine First and the current chair of the AANS CNS Joint Section on Spine and Peripheral Nerves, as well as the president of International Society on the Advancement of Spine Surgery. Paul, I'll let you introduce yourself.
Paul Kim, neurosurgeon, also in Charlotte with Dr. Coric at Carolina Neurosurgery and Spine Associates, entering the 14th year in Charlotte, and currently serve as the chief of the neurosurgery department at Carolina's Medical Center for Atrium Healthcare.
Paul, it's always good to talk to you. You and I have had several of these conversations kind of in the past. It's interesting because one of the things that we've talked about is kind of transformative technologies in neurosurgery over the past 20 years that you and I have basically been together. A lot of those with you younger than I am in residency and fellowship, but there are several things that I think have been transformative to my practice in spine surgery over these past 2 decades. And it's interesting because it always isn't the high technology stuff. There's certainly the things that I would point to as transformative would include the artificial discs, which you and I have both done a lot of research in both lumbar and cervical, motion preservation, as well as navigation, which I think has kind of come to the forefront now with robots. And those are certainly some sophisticated technologies that have been transformative. But equally, really, if not more transformative in my practice, have been some relatively smaller kind of technological innovations that have been equally as transformative. And one of those has been the bone scalpel, as you and I have talked about on numerous occasions. It really has changed the way that I'm able to do my practice. I started out using it for basically my open degenerative cases. As you know, I do a lot of PLIF and PLIF. Degen sorts of conditions, including spondylolisthesis and redos and salvage cases, etc. But then, I began to use it even more in my practice. That I found a place for it in our adult deformity cases that you and I have done together. And that includes using it for Smith-Peterson osteotomies, Ponte osteotomies, and ultimately even pedicle subtraction osteotomies. And as you know, it's come to influence my practice really in almost all aspects of it. Now that I do it in our outpatient surgery center, I do it for my decompressive laminectomies when I'm trying to be very exacting with my cuts. I do it for my posterior cervical laminectomies with and without instrumented fusions, because again, I'd like to stay out of the canal in cases with a lot of spinal stenosis and in the cervical spine especially, and then thoracic decompressions for tumor trauma, etc. So it's really permeated my entire practice. And if I look at things that aren't maybe as thought of as sophisticated technologies, but things that have really changed my practice have included morselized flowable gel foam with the thrombin, which has allowed us to do tumor cases in some of our bigger degenerative cases with less blood loss while we work in the canal. And it's the same thing with the bone scalpel, how it's really allowed me to cut down on my blood loss on those bigger cases. As it cauterizes the bone, it's made me more exacting in my cuts in the smaller cases. And in cases of severe stenosis in the thoracic and cervical spine, it's really kept me out of the canal. So it's really been something for me that has been transformative, on par with some of the other transformative technologies I've seen over the past 2 decades in my career.
Yeah, I would agree with you on all your points. Interested, there a lot of technologies have improved spine surgery, different techniques, but when you look at the bone scalpel and the ability, as you said, to make exacting cuts or osteotomies, that's a significant improvement from the use of osteotomes, which is a fairly barbaric way of doing surgery, but we have continued.
Especially when you and I are together doing them.
even the use of high-speed drills, as you know, on hypertrophic bone, really sclerotic bone, even high-speed drills with the best of control have a tendency to skive or move and can affect our ability to be precise and be safe, you know, within neural elements. So this has been a technology, as you said, that has allowed us to make really precise cuts to help with decompressions under a controlled fashion, and you know, the hemostasis that you get with these cuts, as opposed to the amount of splatter out of the wound, you know, in exposure that we would get on a regular basis with use of other sort of old school type instruments. It really has changed, and you know, naturally it's gravitated toward more than just a laminectomy or decompression tool. We've used it, as you said, you know, with more complex cases like corpectomies and osteotomies, other type of techniques that demand an exacting cut or resection to be performed. And nothing works better, at least in our experience, than this, you know, particular technology for achieving that.
Yeah, it's kind of interesting that you brought up the, you know, the drill, because, you know, there always is a certain nervousness associated with getting the drill around the dura, you know, completing PSOs and potentially getting, and vertebrectomies, getting drills into the vertebral body in front of the dura. That's kind of always one of the things that people ask me when I talk to them about how bone scalpels really taken over is such a central role in my practice. And they always ask, well, what about dural tears? And I can tell you that the potential for disaster with the bone scalpel compared to the drill or an osteotome, it's really night and day. It is, you know, if you've ever had the misfortune of kind of wrapping up the dura in a high-speed drill, it's an absolute, you know, one of the things that is a disastrous potential complication, and it's just not something that you see with the bone scalpel. And you know, and then even osteotomes, so much less control, and like you talk about the blood splatter and things like that. You know, at the beginning, I kind of used it like we talked about for my DPN cases, but at this juncture, I even lean on it heavier in the bigger deformity cases as well. So it really is something that has come to my everyday practice, and something that, again, has been truly transformative to my practice.
Yeah, one comment I'd make is, and you've demonstrated this, is you know, with new technology, there's always concern about, if you change the way you're doing things, what's the learning curve, and is it something that takes you know, a number of cases to become comfortable or familiar with, and it really doesn't. And you've demonstrated that, as we've seen this start in the lumbar spine, and even move to, you know, cervicothoracic decompressions. You know, or really with the same, you know, type of ease and results. So that's been impressive to see that evolution.
Yeah, I mean, I do think, like anything else, there is a variable, you know, learning curve. I think some people kind of get it, and as you know, both, you know, Sam Tuning, one of our other partners, orthopedic spine, and I, you know, it kind of clicked early for us, and I would consider us kind of early adopters, and because of that, we've become a little bit more aggressive and sophisticated, and we just keep pushing the envelope because it is something that it allows for that. But having said that, I think that it does take a certain learning curve and getting used to the process, but it is not something that, you know, I think once you get it, and once you get comfortable with it, it causes your cases to go faster, with less blood loss, and easier. I'm firmly convinced of that.
I think it's a good point you make. And when we look at the cost of new technology, and you think about the efficiencies that you know, that an instrument or device like this you know, can afford you during surgery. Certainly, I think the efficiency in surgery and the improvements in the ability to get the work done safer, you know, will probably offset the cost, particularly as we look at more multi-level type cases where more decompression or osteotomy work is done.
Yeah, no question about it. I think the value proposition's got to enter it whenever we talk about any new technologies. But enough about me. You're chief of department. I want to hear about your use of Bioventus OsteoAmp in your cases as well, and we've talked about that on numerous occasions.
Yeah, you know, so as you and a lot of folks with our experience, this particular product, the OsteoAMP product, is really a remarkable one in terms of the variety of different formats or substrates in terms of the allograft used, whether it be a sponge allograft that conforms well to disc spaces or corpectomy type defects versus sort of the shredded fiber form that's very malleable and easy to place along the posterolateral gutters or within disc spaces, which provides a real attractive use for interbody fusions. And now sort of the evolution of a flowable bone graft delivery option, which is ideal for minimally invasive cases. Now, we've seen these different allografts over the years with a number of different companies, but you're now looking at what really is probably a premium allograft, which gives us basically the optimal bony fusion potential, now available in different forms to allow us to achieve fusion in a number of different ways. So when we look at the challenges that we have in fusion and we look at some of the other alternatives from a cost perspective with Infuse and other similar type of allograft or bone graft extenders to some of those sort of non-cadaveric allografts, you see a disparity in success rates, or at least osteogenesis or osteoconduction for sure. And so it's been very difficult to identify a bone graft, number one, that has optimal fusion capacity, which is cost effective and yet is available in a variety of different forms to help you achieve fusion both in a minimally invasive fashion, which is attractive for us on a number of the T-lifts that we do, or in a more open fashion as we look to try to achieve fusion along a multi-segment construct.
Yeah, you're definitely more of a science geek when it comes to the biology of bone forming agents, and that's kind of, and I know that basic research is what kind of got you interested, and why you brought it to me. And but from my perspective, I don't want to be Neanderthal about it, but the thing that was most attractive to me is certainly at the beginning, until I started getting more results that were showing obvious fusions, was the handling characteristics that you've talked about. It is just, I felt like there were a lot of products that were soupy that potentially ended up in my drains by the time I was done with the case. Some were clunky and didn't, mix well. I basically use a 50-50 mix of local autograft prepared through a bone mill, and I like to mix it with my allograft as an extender. And things that and the handling characteristics to me were very important, how they kind of fit together, how they stayed in the lateral gutters, how much I could pack in the disc space. As you know, I'm kind of old school with open T-lip and open pliff, and I like to really prepare that disc space. And I know you're the same way. When we operate together, we spend most of our time in the disc space with disc debulking and preparation and end plate preparation. And I know you, like I, are trying to get somewhere about 10, 12, 14, 16 cc's of bone in the inner body space. And so I think those handling characteristics are really kind of what got me interested, after you kind of brought it to me to begin with. But then, ultimately, as we've been using this over a period of years now, able to see our CT scans. And I know you, like I, get CT scans at about 1 year after all our fusions. And to see the high fusion rates to go along with the ease of use and the handling characteristics, that's really kind of closed the deal for me.
Yeah, agreed with all those points. When we look at what are the downsides of this in comparison to other competitive bone graft or bone graft extenders, the osteolysis that has been seen in other products early on, particularly in the disc space with interbody fusions, is not a phenomenon that occurs with these OsteoAMP products. And nor is the neuritis that has been characterized, in the literature for other competitive products. In addition to that, we've yet to see the heterotopic or the ectopic bone formation, particularly in the lateral recess of foramina, that's been a radiographic hallmark of maybe some of the other products on the market. So this product has checked all the boxes in terms of handling, delivery, and fusion potential without some of the sort of the complications or concerns that we've seen in the past.
Yeah, and like we talked about, it's something that I think is kind of permeated both our practices, and not just in the lumbar degen, but also for adult deformity cases, and then obviously use it in cervical spine as well, including anterior cervical. I just did a corpectomy, a multi-level corpectomy the other day, and I just felt good about the way it packaged into my graft and around my spacer. And so to me, that really has been a game changer.
Do you mind saying a couple words about how you feel about Misonix and Bioventus coming together as one company?
The partnership or merger of Misonix and Bioventus is exciting from our standpoint. We're fairly familiar with the strengths that each company brings to the table for spine care. So, when you look at now more of a comprehensive sort of management of spinal surgery, we look at the ability to have the optimal handling and control with laminectomies, with decompressive work, with use of the bone scalpel, paired with what we think is the best handling bone graft products on the market with the highest fusion capacity. That combination really positions Bioventus well, to continue to grow in the spine market.
Yeah, I totally agree, Paul. One of the things that we've talked about is this concept of enabling technologies. And again, a lot of times people, when you talk about enabling technology, you're talking about sophisticated machinery like intraoperative navigation. But in the broad sense of enabling technology is something that allows you to get your cases done and get them done efficiently and better. I'm excited about the merger of Bioventus and Misonix because they really represent two of the products that I consider to enable my spine surgery. And as you know, I've been a big fan of the Misonix bone scalpel for a long time, and it's something that has really permeated my practice. And really with Bioventus, we've talked about OsteoAmp kind of being best in class for an allograft product, and having both those companies come together is an exciting prospect. And I'm really looking forward to what they can kind of bring to the table to continue to make our surgeries, even our most complex to our minimally invasive surgeries, work better. And I'm excited about the prospect.